You know, in emergency medicine, there are situations that are urgent, and then there are situations that are a flat-out sprint against the clock. Bacterial meningitis, that's definitely the second one. This isn't just about a bad headache. It's a full-blown crisis where every single second can determine whether someone lives, dies, or is left with a lifelong disability. So let's get into what makes this disease so terrifyingly fast.
And just to be clear, that's not hyperbole. This quote right here from the New England Journal of Medicine really sets the stage. We are talking about a disease so aggressive that if you do nothing, survival is pretty much off the table. It is one of the most sobering statistics you'll find anywhere in medicine.
So, what exactly is this thing? What is this invader that kicks off such a frantic, all-hands-on-deck response in the hospital? Let's get right to the heart of it.
Okay, so at its core, bacterial meningitis is an infection of the meninges. Just think of the meninges as these super thin, delicate layers that wrap around and protect your brain and spinal cord. They're like the last line of defense. When bacteria get through that barrier and cause everything to swell up, they're essentially launching an attack on the command center of your entire body.
Now, these are the classic signs you'd see in a medical textbook, but in a real-world ER, it's way messier. A lot of patients don't show up with this perfect checklist. Maybe they just have a high fever and seem really confused. Or they have a splitting headache, but their neck feels fine. And that is exactly what makes spotting it early on so incredibly difficult.
Right. So because the symptoms can be all over the place, the second a doctor even suspects meningitis, a high-stakes investigation kicks off. It really is like a detective story, but one where the clock on the bomb is ticking down fast. And this brings us to the first huge fork in the road for the ER team. Do you rush the patient for a CT scan of their head, or do you go straight for the test that will give you the answer, the spinal tap, also known as a lumbar puncture? Making the wrong call here could cost them everything.
This whole decision comes down to one thing: balancing speed with safety. You only do the CT scan first if you're worried about brain swelling. See, if there's a lot of pressure inside the skull, doing a spinal tap could be catastrophic. It could actually cause the brain to shift downwards or herniate, which is often fatal. But if none of those red flags are there, the rule is crystal clear. Go straight to the spinal tap. Every minute you save by skipping that unnecessary scan is another minute you have to fight the infection.
And this is why that spinal tap is so critical. The fluid that surrounds the brain and spinal cord, the CSF, it tells the whole story. Normally, it's crystal clear. Barely any white blood cells, normal sugar levels. But when bacteria invade, whoa. The CSF becomes a war zone. The white blood cell count just explodes. The bacteria start gobbling up all the glucose for energy, so the levels plummet. And all that inflammation makes the barriers leaky, so protein floods into the fluid. These numbers are the smoking gun. There's no hiding from this.
Okay, so once the evidence points towards meningitis, and honestly, often even before it's 100% confirmed, the counterattack begins. There is absolutely no waiting around.
These 4 steps are the playbook for the initial response, and they happen in a blur. You draw blood cultures to see if the infection is in the bloodstream. You do the spinal tap if it's safe. You give a steroid called dexamethasone to try and calm down that dangerous inflammation, and then, bam, the first dose of heavy-duty, broad-spectrum antibiotics goes in. This all has to happen within the first golden hour.
And I'm not just saying that. It's not a catchy phrase. In bacterial meningitis, brain cells are literally dying. The infection is spreading. The body's own immune response is so powerful it can cause permanent damage. The outcome doesn't change day by day, it changes minute by minute.
And what does this number mean? That's the mortality rate for patients who have a significant delay in getting that first dose of antibiotics. We're talking a delay of just a few hours. That's how thin the line is between a full recovery and a fatal outcome. It's why things look like controlled chaos in the ER when a case like this rolls in.
So, that first antibiotic dose is what we call empiric. It's a broad attack, like a shotgun blast, designed to hit all the most likely bad guys. But from that moment on, the fight gets a whole lot smarter.
Here are the usual suspects for adults: Streptococcus pneumoniae and Neisseria meningitidis. These two account for almost all cases, so that initial antibiotic choice is designed to wipe both of them out. You also see Listeria on there, which is more of a worry for older folks or people with weak immune systems, so the treatment plan often changes based on a person's age and health.
This is where the lab gives the docs their first piece of battlefield intelligence. There's a quick test they can run on the spinal fluid called a gram stain, and it can give them a huge clue, sometimes in less than an hour. If the lab calls and says they see gram-positive spheres, the team immediately thinks pneumococcus. Gram-negative spheres?
It's probably meningococcus. This lets them pivot from that shotgun blast to a sniper rifle, zeroing in on the specific invader way before the final lab results come back.
But even with a super-fast diagnosis and the perfect antibiotic treatment, the battle against meningitis can leave scars. Surviving is just the first step.
In this chart shows you a pretty harsh reality. Not all bacteria are the same. Even with all our modern medicine, meningitis caused by S. pneumonia, the most common one, still has a jaw-dropping 30% mortality rate. The firestorm of inflammation that this specific bug causes is just so destructive. So yeah, the specific bug you're fighting matters. A lot.
And for the people who do survive, the fight might be over, but the damage can last a lifetime. That inflammation around the brain can lead to devastating, life-altering problems. Hearing loss is one of the most common, but people can be left with seizures, weakness, or cognitive issues. Winning the race against time doesn't always mean you cross the finish line completely unscathed.
The whole ordeal with bacterial meningitis is this incredible, brutal test of a hospital's speed, teamwork, and precision. It's a terrifying reminder of how fragile we are, and it really makes you wonder, doesn't it? What other invisible, high-stakes races just like this are being run and won in emergency rooms all over the world, right this very second?